The most common type of genetic testing, however, is called PGT-A, and that's where you're looking for aneuploidy. All we're doing is counting chromosomes. Now, many clinics incorrectly sell this as making sure your baby is normal. Well, we really can't do that because there are 23,000 genes, and that's only 2% of the whole genome, so we don't know enough to really do that. However, we can count chromosomes and decide whether your baby would have too many or too few copies of a particular chromosome. For example, Down syndrome is caused by 3 copies of chromosome 21 instead of 2 copies of chromosome 21. Now, if there's only 1 copy of chromosome 21 or any other chromosome, well, then that's just not going to be a pregnancy because that's incompatible with life. But if there are 3 copies, that's a kind of aneuploidy that can lead to miscarriage, to not getting pregnant, or in the case of Down syndrome, lead to a Down syndrome baby. So generally, the aneuploid screening is of very limited use because the risk of Down syndrome in a young woman is 1 in 2,000, and in a woman who's 40, it's still only 1%. And so you're not really reducing the major problems. But everybody is afraid of Down syndrome, and you can virtually eliminate Down syndrome with PGT-A by just counting the chromosomes and making sure not to transfer an embryo that has 3 copies of chromosome 21. Now, there are other aneuploidies too that cause miscarriage or failure to get pregnant. And we wouldn't transfer those either, because now we know that if it's diagnosed as aneuploid, that is too many or too few copies of a chromosome, it'll not result in a baby, or it'll result in miscarriage, or it'll result in Down syndrome. So it's very accurate for that. So the limitation to this is that, well, let's say what the advantage is. The advantages are limited. You can eliminate virtually the risk of Down syndrome, and you can reduce the risk of miscarriage by about 50%. That's the advantage. It seems to only be of use in women between the ages of 34 and 40. Because under 34, miscarriages are uncommon, and Down syndrome is like 1 in 2,000 or 1 in 2,500. So most women under 34 are not going to want the added expense of genetic testing of the embryo and biopsy for aneuploidy. And over 40, the best way to get pregnant is to save up day 3 embryos, and that gives you the highest success rate. And then you would just accept that there's a 1% risk of Down syndrome, which you could diagnose with a simple blood test at 10 weeks of pregnancy. And so for women over 40 with challenging eggs that have a low fertility rate, we have really remarkably good results. However, it's probably not wise to or beneficial to try to do aneuploid screening for those cases, because we're really saving up very small numbers of eggs. However, it's possible, but not usually that popular in those women that are most likely to have Down syndrome, that is, women that are over 40, where it's 1%, and at age 44, it's as high as 4%. So aneuploidy screening is very valuable, most valuable in women ages 34 to 40. We're happy to do it for you. And you may decide not to go through the extra expense and bother if you're under 34 or over 40. On the other hand, we could do it for everybody if that's what you desire.